Living, the nonprofit that's putting on this event, so we want to thank them for this. And yeah. And I just want to mention that all these talks that are more medically oriented, we want to make sure we have a disclaimer that before we make any kind of significant diet or lifestyle changes, make sure you're in contact with your medical provider. Because a lot of times, if you're on blood pressure medications and you make a big change in diet or lifestyle, your blood pressure could drop too low, and you might have to have your provider reduce your medications. Same with diabetes. If you're on insulin or blood pressure or blood sugar lowering medications, you might have to have those medications lowered or adjusted so your blood sugar doesn't get too low. So definitely, lifestyle change is very significant, really significant, powerful change. So just be careful with that. And so I'm going to go ahead and introduce we'll let her introduce herself, our next speaker. And here you go, Kristin.
Great. So I'm Dr. Kristin Linzmeyer. I'm board certified in general cardiology as well as in lifestyle medicine. And I work at Riverbend at Oregon Cardiology. So if you ever want to come and visit, come and say hi. You can schedule an appointment if you want to. So can we get started? So I'll go ahead and just chat a little bit while you're getting that. One of the reasons I became, let's move this. One of the reasons I became interested in lifestyle medicine after practicing for 10 to 15 years in general cardiovascular medicine was that at the end of the day, I would come home and I just felt like I was beating my head against the wall. You know, we would try and throw in some lifestyle recommendations like increase your physical activity, walk more, really try and get more fruits and vegetables in your diet. And I'd see people back in 6 months or a year and they'd gained 10 more pounds and their blood pressure was going up, and I'd add a fourth blood pressure medicine and I'd have to put them on a statin, and then not just put them on a statin, but increase the statin because, things were just not going in the right direction. And in healthcare in general, we are really, really good here in the United States usually at finding disease and treating disease. Our cancer mortality rates are going down for many cancers. That's great, in part because we're detecting them faster and younger and getting them treated more aggressively. But it's about finding the disease. It's this sick care medicine and not always health care. And that was something I just found myself increasingly frustrated about and wanting to do something about, but not exactly sure of how to go about it. So the title of this talk is Carrot or Stent: Preventing Cardiovascular Disease with Lifestyle Medicine. If you've already had a cardiovascular event, it's okay. You can still make a ton of strides and impact with your lifestyle to prevent another one. But the majority of people in our country just have risk factors for cardiovascular disease. They've not yet had that first heart attack or that episode of congestive heart failure or the stroke. And that is where my passion really lies, is working on lifestyle, sometimes in conjunction with pharmacologic therapy if absolutely necessary, but really working aggressively on lifestyle so people don't have to go into their older years on 15 medications and feeling poorly. It's great to live longer, but it's not always ideal to live longer feeling unwell. I can't think of anybody who wants that. So that's where this comes into play. And hopefully we'll get this figured out so we can progress on. So, thanks, Christine. So cardiovascular disease is a systemic problem. It's basically can involve your body from head to toe. Cardiovascular disease, by definition, includes things like heart attacks, like strokes, like peripheral vascular disease, where you get blockages in the arteries going down, say, into your legs or into your kidneys that cause symptoms. And it also includes things that you don't necessarily think of as a cardiovascular disease, like erectile dysfunction. There are many men who believe that their vascular system is totally healthy, but they struggle with erectile dysfunction. We call that the canary in the coal mine. Okay, that is a vascular disease. Yes, there are problems like medication side effects that can contribute, testosterone deficiency that can contribute, things like that. But it is the canary in the coal mine, and that should be an eye-opener that any risk factors that you have need to be aggressively treated. Cardiovascular disease also includes things like congestive heart failure. We'll talk about that briefly. And certain types of arrhythmias, abnormal heart rhythms are called arrhythmias, like atrial fibrillation. And the thing about treating the risk factors for cardiovascular disease is that it's usually going to, and almost always going to, also prevent other diseases like cancers, like dementia, like lung disease or kidney disease. We have a saying, what's good for your heart as far as lifestyle, exercise, nutrition, what's good for your heart is good for your head. If it's going to help your heart stay healthy, it's usually going to help your brain stay healthy too, and help prevent things like dementia. It's also going to help protect your kidneys from chronic kidney disease and needing to go on dialysis at some point. So what's good for your heart is good for your head. Go ahead. So if cardiovascular disease is the #1 cause of death in our country, then as far as the premature death, which is cardiovascular disease, the contributing factor, the #1 contributing factor to or for cardiovascular disease is diet. Tobacco's up there also, yes. Physical inactivity and obesity is up there also, yes. But #1 is our nutrition. And there's a you probably have heard this, the Heart Attack Grill in Vegas. When you go into a Heart Attack Grill, it's a diner, and you get weighed. If you weigh over 350 pounds, you get their single bypass burger. You can get as many of those as you want to eat for free. So they name their burgers bypass burgers, and depending on the number of burger patties you get is the number of bypasses. So if you get 3 burger patties, which by the way are all fried in lard, you got a triple bypass burger. Yeah, their French fries are also fried in lard, and they're called flatliner fries. Yeah. So the Heart Attack Grill is an example of the standard American diet. Sad. It's pretty sad. Okay, standard American diet. Good. And yes, you can get that with probably lots of cheese. Oh, yay. All right, we're making progress. So how does diet harm? How does unhealthy diet choices harm us? It's through things like certain types of fats, mostly saturated and trans fats. So these types of fats are inflammatory. They are direct inflammatory factors. So if you can imagine, you twist your ankle, and your ankle becomes really swollen and inflamed, and it hurts. And you then keep walking on it, and you keep twisting it, and you keep injuring it over and over again. You're going to have chronic inflammation and probably end up with chronic arthritis of that ankle. Okay, same thing with how we eat. If we're eating a food that is very high in inflammatory products, like a lot of saturated fat and trans fats, the worst damage to our vascular system is within the next 4 hours. Okay, so you get all this damage, all this inflammation to your blood vessels in the next 4 hours. Well, what do you do about 4 hours after that meal? Well, you're eating again. Then, so after the bacon and eggs for breakfast, then you're eating the ham and cheese sandwich for lunch, and then about 4 to 6 hours after that, you're eating the burger and fries for dinner. And so it's this repetitive inflammatory stress and oxidative stress on our blood vessels that causes chronic damage and leads to cardiovascular disease. Go ahead. So what does our body do to defend ourselves? We can produce some really healing factors and molecules in our body to help our blood vessels. So one of the most important is nitric oxide. So you maybe know people who have to take nitroglycerin under their tongue to help prevent chest, or to help treat angina, chest pain from their heart. Well, nitroglycerin helps increase your body's production of nitric oxide, and so it dilates your blood vessels, and then their angina goes away. Your body creates nitric oxide, but if you have damaged blood vessels, it cannot do a very good job of creating producing nitric oxide on its own. And so it dilates arteries, like I mentioned. It decreases the stickiness of certain blood cells like platelets, which help form clots, which you don't want in your blood vessels. It decreases plaque formation. That's that atherosclerosis, that sludge that clogs up our arteries. And it decreases the smooth muscle, which is kind of like scar tissue, and inflammatory cells in the lining, our endothelium of our blood vessels. We have endothelial progenitor cells, which help heal our blood vessels, HDL, which is your good cholesterol, which helps remove bad cholesterol from your circulation, and then short-chain fatty acids, which are wonderful, wonderful molecules that are made when you eat foods that are high in fiber and you have a healthy gut microbiome. And we'll talk briefly about that later, but those are wonderful, wonderful substances that our body creates through the help of our gut bacteria. So eating a whole food plant-based body will help our bodies produce the substances that we already know how to do in larger amounts. Okay, go ahead. So what is coronary artery disease? These next few slides, I'm just going to discuss briefly what are certain types of cardiovascular disease. And so coronary artery disease is the #1 cause of cardiovascular disease. It is what causes heart attacks, and the building blocks of that atherosclerosis that clogs up our arteries is cholesterol and inflammation. Go ahead. And sorry, back to that last slide. You don't have to go back, but when you get enough inflammation that disrupts the plaque buildup in your arteries, your body senses that there's an injury there. It's so inflamed. It's just like if you cut yourself and your body wants to go in and rush in there and heal it. So it brings all these cells and these platelets and it forms a clot. Well, if you've got a little tiny coronary artery and a clot blocks off the blood flow, that is a heart attack. Okay? So arrhythmias, I'm just going to briefly touch on the most common type of abnormal heart rhythm, and that's atrial fibrillation or flutter. And our Wi-Fi is not working, but on the left side, it's supposed to beat, the upper chambers of the heart are supposed to beat in a nice, synchronized, efficient manner. Well, with atrial fibrillation, your upper chambers, your atria, fibrillate and flutter. They're moving very chaotically, and they're not pushing the blood through those chambers as efficiently as it should. Well, what does blood do when it sits around? It clots. And so worst case scenario with atrial fibrillation, and I have seen some devastating cases, is that if one of those clots breaks off and moves through your circulation and gets lodged up here, it can cause a horrific stroke. And that's why so many people with atrial fibrillation need to go on blood thinners. Okay, go ahead. So it is very much a disease of inflammation. Now, there is probably a hereditary component. There's other components that may influence your risk of developing atrial fibrillation, but inflammation is a big one. So food can increase your risk. Infections, we see a lot of atrial fibrillations when people are admitted to the hospital with sepsis. And then alcohol is a direct toxin to the heart, and we see a lot of AFib that is related to alcohol use. Even very high levels of exercise. I'm talking about these ultra endurance athletes that go off in the mountains and run 50 miles at a time. There is some evidence that because of all of that inflammation in their body from that level of activity, it can increase their risk of AFib. So other risk factors are similar, and you're going to see a pattern here for other types of cardiovascular disease. High blood pressure, obesity are all risk factors for atrial fibrillation, and low-carb diets, which are very popular, have been associated with higher incidence of atrial fibrillation. And the thought is that if you are decreasing those really healthy carbs in your diet that are full of fiber and full of antioxidants, you're not getting the benefits of those anti-inflammatory foods that can help prevent inflammatory conditions like atrial fibrillation. Okay, go ahead. And then the worst arrhythmia that anyone could have is one that causes death. Ventricular tachycardia, ventricular fibrillation. These are arrhythmias that usually happen when you have a really weak heart, like you have congestive heart failure. You've had old heart attacks, so you have scar. You're having an acute heart attack right then and there, and the first sign of a heart issue can be a cardiac arrest. So at the upper tracing is a nice, normal, steady rhythm that's providing circulation to your body. And the bottom one is ventricular fibrillation, where those bottom chambers of your heart are just quivering. It's not providing any circulation, and you die if you don't get shocked out of it. Go ahead. And then I'm just going to end with stroke. There are two major types of stroke. There's the clotting type of stroke, which is the same as the cause of heart attacks, except it's in the arteries going up into your brain. It's caused by atherosclerosis, which is caused by cholesterol and inflammation, and you form a blood clot. And then the other type is a hemorrhagic stroke, where you have a blood vessel that maybe is dilated from having high blood pressure for many years, or if there's an aneurysm that forms and it ruptures because the wall of the artery gets weak and people can bleed into their brains. Go ahead. The next slide is more of my public service announcement to everybody. There are two, with cardiovascular disease, there are two major events that are extremely time sensitive. One is a heart attack. Muscle is dying every second that you wait to get that blood vessel open. It's a very time sensitive emergency, and that's why people are rushed to the hospital by the paramedics, and they go and get the arteries opened. And stroke is another one. So we say time is muscle or time is brain. You're going to get brain function back and not have as many permanent deficits or problems the sooner you get that blood vessel opened. And so this is just a little Be Fast, and I guess it's an acronym for the ways to spot a stroke. So B is balance loss. If people seem like they're having vertigo or they're losing their balance, which is new. Eyesight changes if they mention that they have a curtain coming down over their eye or they have lost a vision in one of their eyes. Face drooping. If you're worried somebody has had a stroke or is having a stroke, have them smile. One side of their face is going to stay down and the other one's going to go up. All right? Arm weakness, you can have them hold their arms out like they're holding a platter. And if one starts to droop down like they can't keep it up, that's time to call 911. And then speech difficulties. If they're having garbled speech, having difficulties getting any words out even though they're obviously trying, you call 911 because this is very time sensitive emergency. Okay, go ahead. Oh.
All of those?
No. Just one. Just one of those. You know, it's always better to have a false positive or a false negative, and be wrong and then go home and everything's fine than to wait it out and then you've lost a lot of brain tissue. There's somebody over here who had a question, I thought. Somebody was raising their hand. No, you're good? Okay. Oh, and then one more, congestive heart failure. Congestive heart failure is incredibly common and it's increasing in prevalence in our country. And most types of congestive heart failure are caused by other types of cardiovascular disease. And the most common kind is having multiple heart attacks that cause enough dysfunction of the heart that the heart becomes extremely weak. So things like heart attacks, atrial fibrillation, which makes your heart race, like it's running a marathon all the time and your heart starts to wear out. High blood pressure can cause congestive heart failure. Certain types of valve problems like aortic stenosis or mitral regurgitation. Obesity and diabetes can cause a type of heart failure. And then, of course, there is a genetic or a hereditary type. Go ahead. So the normal heart on the left has a nice normal thickness of the heart muscle. The chamber is not dilated. And every time your heart squeezes out blood, it pumps out blood. It pumps out about 50 to 70% of the blood in the heart chamber. That is normal. That is called your ejection fraction. So every time your heart squeezes, if it's pumping out about 60% of the blood with each pump, great. One type of heart failure where the heart is really weak, the heart can be really dilated like it is over on the right, and the wall starts getting really thinned out and weak. And you can see people who have an ejection fraction of 30%, half of what it should be. I see people all the time who have heart functions of 20% or lower, and their heart's barely moving. And they have to be on a lot of medications to try and improve their heart function. The second type of congestive heart failure is where you have a really nice, strong pump. It's still pumping, but it's really stiff. It's having a hard time relaxing. Okay, that's often seen with high blood pressure, with obesity, with diabetes, and it also is more common in women. So that can cause just awful heart failure symptoms also, even though the heart strength is still normal. Okay. Okay, so this is kind of why everybody's here, is to talk about, well, what can we do to prevent all of these awful diseases? Or even if you have the diagnosis of some of these diseases, how do I prevent it from getting worse? How can I prevent relapses? So your genes are not destiny, and I'm sure if any of you have been to any of the other talks from earlier today, you probably heard that especially with cardiovascular disease, lifestyle factors and our lifestyle habits and choices account for at least 80% of the development of cardiovascular disease. Genes really only make up maybe 10 to 20%. Now, other diseases, that may differ a little bit. Certain cancers, there certainly are lifestyle factors that can increase your risk of certain cancers, but that may be a little bit more genetically based depending on the cancer. But with heart disease, it is very, very driven by our lifestyle choices. Go ahead. So for the sake of time and to make sure that there's time for questions, I'm not going to go through a lot of studies, but I'm just going to, you can look at these and you can always look these up if you want and do your own research. But there are a number of very large studies that have looked at hundreds of thousands of people and followed them over time to see, what do they eat? How active are they? Do they smoke? Do they drink? And then they see, do they get diseases? How long do they live? And they have found over and over again that people who eat a plant-based diet and also exercise regularly and don't smoke, but a plant-based diet, they live not only longer, they live healthier years living longer, and they develop fewer diseases. So over and over again, this has been shown. And one exciting thing, I just realized that maybe this news has been out for a while, but I just found out recently, and this is something I'm just really thrilled about, and I'm going to pull this up so I make sure I quote it. Yeah, so in 2025, you know that the U.S. puts out dietary guidelines every so often. Sometimes it could be a decade before they revise the guidelines. So this is the U.S. Dietary Guidelines Advisory Committee. For the first time, has recommended to decrease saturated fat in our diets specifically to prevent cardiovascular disease, number one cause of death in our country, that moving toward plant-based sources of protein, which tend to have far less saturated fat in it, is recommended over animal-based sources of protein, especially red meat and processed meat. Furthermore, they no longer can recommend that people who are switching to other types of meat in the animal-based category. I can't tell you how many times I have patients who come in and say, well, I only eat chicken and turkey. I don't eat red meat. They no longer can advise that is going to decrease the risk of cardiovascular events because there's not enough evidence. There's still plenty of saturated fat in those products, especially since we eat so much of it. And they also included dairy in that category. So this is the first time, and I'm really pleased because there's so much confusion out there of what we are supposed to eat. What we're, and doctors are confused. Primary care providers are confused, and they may have heard, well, this is healthy or this is healthy. And I suppose everybody's different, and what works for one person might not work for everybody. In general, though, the fact that the U.S. dietary guidelines are finally catching on, I think, is a huge step forward, where we can now say, listen, we have pretty irrefutable evidence that plant-based sources of protein, especially those that are low in saturated fat, are healthier for you in order to prevent cardiovascular disease. So that's very exciting. Go ahead. I just want to give an example here of a very small study where Dr. Caldwell Esselstyn, who's one of the founding parents of lifestyle medicine and plant-based eating to prevent disease. He did a study back before there were statins, before there were a lot of cholesterol-lowering medications and a lot of the medications that we have currently. And he took these people who were the walking dead, I think they were called, because they needed bypass surgery and they either didn't want to have bypass surgery or they were too high risk to have it. They were basically told that you're going to go home and die within the next year. So he took them and he said, if you want a chance, follow my study. And he put them all on a low-fat, whole food, plant-based diet. And on the left, and I'm going to just go over here and show you what you're looking at. The white line from the top coming down here is an artery, and it's filled with dye. It's filled with contrast dye, and that's why it looks white, and there's a little x-ray picture that's being taken. And you can see that at the top, it's pretty open, it's pretty big, like a big garden hose, and then down toward the bottom, it starts looking really ratty and moth-eaten. And it's very heavily, especially right here, that's probably an 80 to 90% narrowing right there. Here's a little aneurysm formation. And he put this person on a whole food plant-based diet, a low-fat one. And 32 months later, he repeated their study, just on the diet alone. And that is what their artery looks like. So it is possible to not just prevent cardiovascular disease, but to reverse it. Okay, next slide. So when you go and see your primary care provider or any clinician, and they're telling you, well, for your blood pressure, you should go on a DASH diet, which is high in fruits and vegetables and naturally low in sodium, or a Mediterranean diet. Everybody's heard about the Mediterranean diet. It's a really pretty healthy diet. Portfolio diet is a completely whole food plant-based diet. That's to help lower cholesterol. The Mind diet is a diet where they looked at dietary choices to prevent dementia, really high in antioxidants like blueberries, walnuts. And then there's a vegan diet. And these are all good diets. Some of them allow for a little bit of dairy, a little bit of fish, a little bit of lean meat, but all of them emphasize fruits and vegetables, things that are very high in fiber. So they're not bad choices. We can continue to do better. And I have people who are on like a Mediterranean diet, but they have heart disease. So I try and move them along a spectrum of getting more toward a whole food plant-based diet if they really want to help prevent more medications being added or having another cardiovascular event. The reason I put a question mark next to the vegan diet is that I personally don't like the V words, vegetarian and vegan. And it's not because they're bad. It's just that it doesn't really tell people what you eat. It just tells people what you don't eat. So go to the next slide, please, Christine. So there is actually a dietary spectrum with vegan diets. And I bring this up because this is really, really important. There are now a number of studies that have come out that have shown that an unhealthy vegan diet that's very high in processed foods and ultra-processed foods is worse for you as far as health outcomes compared to eating like an omnivorous diet, like some meat, potatoes, veggies, kind of like a healthy, well-balanced omnivorous diet. It is worse for you to eat all that processed food but still consider yourself vegan. So that's why I just want to make sure that it's very clear that maybe not all vegan diets are created equal. So healthy carbs that are found in a whole food plant-based vegan diet are complex, nutrient dense, but often very low in calories. They're high in fiber, which is really what we're deficient in as a society as a whole. They're high in vitamins, minerals, antioxidants, those phytochemicals that help us, fight off cancer and cardiovascular disease. And examples are whole grains, legumes, fruits, vegetables, nuts, seeds. Then there's garbage. And garbage is what we want to be avoiding, whatever dietary pattern that you want to subscribe to. And that's highly processed and refined foods. It's loaded with sugar, oil, and salt. It's nutrient poor and often calorie dense. Think of sugar-sweetened beverages. Okay? So pastries, sweets, you can see these vegetarian ultra-processed foods. So French fries, Oreos are vegan. Just saying. I mean, Oreos are tasty, but they're vegan, and if you're surviving on things like Oreos and French fries, that's not necessarily the healthiest choices to make. Okay, go ahead. So when people ask maybe in detail, like, well, what should I eat? Or is this healthy for me? Or which is healthier, this or this? I think it's not a lot of fun, and it can be a little stressful if you lose the forest for the trees. What you eat should be nutritious and delicious. It should not be stressful. And so if you were to just have some take-home points, eat the colors of the rainbow. Your plate should look very colorful with most meals. And the reason is that each one of those colors are there for a reason, and they contain different phytochemicals, different antioxidants, and they all work synergistically together. So if there's one take-home point, eat the rainbow. Try not to eat, even if you're eating mostly fruits and vegetables, mix it up. Try and get at least 30 different fruits and vegetables in your diet weekly. Yeah, I actually tried doing that one time when I was keeping track. I think I made it to like low 40s. So it doesn't have to be huge amounts or serving sizes. I mean, throw some purple grapes on a plate along with some red strawberries and dark green kale, right there, you've got 3. So, okay, go ahead. So, and again, not breaking down individual foods, like these foods lower cholesterol, these foods lower blood pressure, these foods do this. Eating all of these in a combination is going to be really good for you. So nuts, especially walnuts, and Brazil nuts have been shown to lower cholesterol, but keep it to a minimum of maybe 1 to 2 a day, a few days per week, because Brazil nuts are high in selenium. And technically, you could get selenium toxicity if you eat too many, if you're eating handfuls of them. And my understanding about selenium toxicity is that it's a very non-specific, they're non-specific symptoms. They're nausea, vomiting, GI problems, maybe a little tingling in your extremities. So just be careful with the Brazil nuts. Citrus. Pretty much any berry. I'm emphasizing a lot of the dark berries like blueberries, raspberries, pomegranates, cranberries, apples, purple potatoes. White potatoes are fine too, especially if you include the skin. It's more what we put on the potatoes. Sour cream, cheese, butter, or frying them in the form of French fries. Mushrooms, onions and garlic, green leafy vegetables are critical, and I'm going to get to that on the next slide. And then beans. Beans are pretty marvelous. Beans have so much fiber. They have arguably per serving one of the highest amounts of fiber per serving. And fiber is really, really critical for the health of our gut microbiome and the health of the rest of our bodies. Go ahead. So the strongest anti-inflammatories, if people want to know, these are the ones that have been documented to have the strongest anti-inflammatory properties. So that's turmeric is number 1. I put turmeric in my oatmeal, in my smoothies. I put it in so many different things. And it makes it really pretty colored. Ginger, garlic, and then certain types of teas. And then fiber, like I said, because it produces with a healthy gut microbiome, when you're eating a lot of fiber, it produces this most wonderful substance called short-chain fatty acids. Short-chain fatty acids have incredible properties. They can heal your endothelium, which is the lining of your blood vessels. It has anti-cancer properties. It's an anti-inflammatory. It helps heal leaky gut. So eating more fiber, we tend to have plenty of protein in our diet in our country. Okay, people are always so worried about getting enough protein. It's fiber that we should be worrying about. And depending on your age, the amounts that we're supposed to get vary anywhere from like 25 to 40 grams, but you can even do better than that. More fiber is better. Dr. Caldwell Esselstyn, he's the one who did I showed you the angiogram with the arteries and the healed artery. He has demonstrated and has a list of especially dark leafy greens that are really, really high also in nitric oxide. Remember I talked about nitric oxide is something our body produces, but sometimes we need a little boost from the foods that we eat. So those that I've highlighted, that I've put in bold, are the foods that are going to have the highest amount of nitric oxide producing capability, Swiss chard, kale, spinach, arugula, beet greens, and then all of those other greens and other veggies. And I want to add on there, it's not green, but beets. Beets are really, really high in the nitrates that you need to help produce nitric oxide. And then I watched a TED Talk of his, and he gave a little tip that if you put a little vinegar, like a little balsamic vinegar, after you steam your greens, it helps increase the enzyme or activate the enzyme in your body that helps produce nitric oxide. So there's a little tip. And then getting back to fiber, it lowers cholesterol. It improves post-meal blood sugar fluctuations, so you don't get those blood sugar spikes if you're eating a high-fiber meal. Like I said, it's really good for the gut microbiome, and it prevents and heals the leaky gut. One thing I want to add about fiber is a lot of people say, well, I can't eat these vegetables. I can't eat these vegetables. And it's because it causes GI distress. So just about everybody can eat fiber without, even certain foods like beans maybe or cabbage, can eat fiber without a major disaster going on in their GI system. And the reason why people do tend to have problems is that if they're eating a lot of fiber all at once and they don't have that healthy gut microbiome, I think Pam mentioned this in the previous talk, if they don't have that healthy gut microbiome set up to help digest it, you're not going to feel very well. You're going to be kind of miserable. And so if you're not getting enough fiber and you want to increase it, I would just say start low and go slow. And that should help you gradually incorporate fiber into your diet over time until you've got this nice, wonderful, healthy gut microbiome. The gut bacteria that process the fiber into those short-chain fatty acids, like I mentioned in the previous video, I just mentioned this again because I want to advocate, if any of you are interested in reading a book about healthy nutrition, this is a wonderful book, Fiber Fueled. It's by Dr. Will Bulsiewicz, and he is a gastroenterologist. I think he works on the East Coast. He's a plant-based physician. And he wrote this book, and it just goes over in detail about how increasing fiber in your diet can help you live longer, feel better, and heal a myriad of diseases or symptoms that people are having. So if there's one resource to take away, read this book, and it has recipes. Go ahead. So these last two slides are super important, and I guess these would be also the last take-home points if you want to remember anything from these talks. Pam had mentioned some other lifestyle changes for any of you who were in the previous talk. And in lifestyle medicine, we really focus on like 6 pillars. One is nutrition, and I just spent, however long, 40 minutes or whatever, talking about that. But the other ones are just as important. It's just maybe not as important for each individual person. It kind of depends on how well you're doing with these other pillars. So the other pillars of lifestyle that can help you live longer and live healthier are good quality sleep, the importance of your social connections and community support system, stress management, physical activity, and avoidance of toxins like nicotine and alcohol. So none of these lifestyle factors or choices that we make are in a silo. So you could be sleeping well and doing a lot of things, exercising regularly, but if just one of these is something you're struggling with, it can affect all of the other parts of your life. So I'm going to give you an example. If you are sleep deprived, maybe it's because you've got a lot of stress from work or there's some family stress, or you're up late at night watching TV or on your phone doom scrolling, or you're just struggling with adequate sleep. Maybe you have sleep apnea, so you're not getting good quality sleep. What it can do is that because you're chronically fatigued, usually, many people choose to forego exercise because they're too tired, so then you're not physically active. Some people choose to maybe have a couple drinks in the evening because they think it's going to help them sleep, which is really one of the worst things that you can do because alcohol leads to poor quality sleep. It's very disrupted sleep. And then you often reach for less healthy food choices, food options. It has been described that people who are chronically sleep deprived are more likely to choose foods that are higher in fats, especially saturated fat. And they are going to look for carbs, which we've talked about. Healthy carbs, fine. But what's easier when you're tired and you're stressed and you're exhausted to do? Cut up carrot sticks and maybe make some hummus, or open the bag of chips. It's usually opening the bag of chips. Sleep deprivation has been shown to decrease our leptin levels. Leptin is a chemical, a hormone that is created in our stomach when we are eating, and it signals to your brain, I'm full, I don't want to eat anymore, I don't need to eat. So being sleep deprived has been shown to falsely lower leptin levels, so your brain is not getting that same signal to stop eating, so you tend to overeat. So these are just a couple of examples of how just sleep deprivation affects all other aspects of our lives and our health choices. And so even if you're eating a super healthy diet and you're trying to be physically active, figuring out what it is that may be limiting you and that's something that you need to work on is really super important to help your whole self be healthy and feel well. Go ahead. And then finally, I know that all of us have probably received conflicting information or confusing information from healthcare providers. And of course, with social media and online resources, there's just a plethora of information, and I would argue some misinformation out there. And I just want to defend the health care community just briefly. When we were in medical school and training, we got almost zero classes in nutrition. And it's not through lack of desire. It's just we were taught how to find and look for the causes and the symptoms and the signs of cancer so that we didn't miss cancer, and then learn how to treat it. There was so much emphasis on finding disease so we didn't miss anything, and then learning how to treat it. And those are wonderful things. That's great. We do have a really wonderful Western medicine that we can go to if something's really wrong with us. But it takes a long time for people to catch up with the evidence. You're busy with your practices, and you're doing the best you can trying to get updated on like the newest evidence and the newest research. And so, it was only, it was decades ago, but it wasn't that long ago when doctors were sitting there smoking in front of their patients when they were going over results. And so it took a long time for people to figure out and to accept that smoking was the cause of cancer and heart disease. It took decades, and doctors were no different. And so, even bringing this up with your provider, like, hey, I think I would like to go toward a whole food, plant-based, eating pattern is something to bring up with them. Like, I heard it's really good, and they may not even be aware of it. So just understand that not all of that education has been provided or been looked into by providers. I had to go and learn all of this by myself, on my own, in my free time, after I was out practicing for 10 years. And same thing with, Scott, Eric, Charlie, everybody else who's in the Eugene plant-based providers. So just self-education and doing your own research is super important, and then bring it up to your providers and let them know that this is something you're interested in pursuing. Go ahead to the last slide. This is something, if you're interested, you might want to take a picture with your phone. This is a list of my favorite resources, and it's certainly not all inclusive, but they're podcasts, they're documentaries, they're books that I think are well researched, and they are, I've vetted them, and I think they're not propaganda. They're very evidence-based and really good resources for you, because listening to this talk for 45 to 50 minutes is great, but there's so much wonderful information out there that you can get on your own and learn even more. So I'd encourage you to do so. So thank you for attending, and if you have any questions, I think we have a couple minutes.